Good evening, everyone. Thank you for joining tonight's webinar. Our webinars are recorded via WebEx and will be made accessible online after the session. We're now using Cisco WebEx Event Center. If you're having trouble joining sessions and rejoin through the link sent earlier to you by WebEx or by entering our meeting room number 575-416-810 and password is GIS123. May we remind attendees that your mics are muted throughout the meeting, but you can chat your thoughts to us through the chat tab. And for questions, please type them in the Q&A tab. All questions will be addressed at the end of the lecture. Tonight's webinar is Dr. Steve Ebner. Dr. Ebner has 17 years of experience in working with the health sector at both the global and national level to provide technical support to the health and emergency management sectors in countries when it comes to integrating the geographic and time dimensions in their information systems, using the resulting standardized and documented geospatial data in advanced spatial analysis and connecting the health sector to the national spatial data infrastructure. We will now call on our speaker, Dr. Steve Ebner. Hello, Dr. Steve.
Chair, can you hear me?
Yes, I can hear you well.
Okay, good evening, good day, everybody. Thank you very much for joining today. Let me share the screen. Okay, you should be there now. Thanks everybody once again for joining today and for having the opportunity to present. I hope the speed at which Chair was talking is not what is expected from my side. My Swiss genetic will oblige me to go a little bit slower. I have prepared a few slides to start the discussions. I mean, what we really would like to have at the end of this presentation is to hear from you, not only on the concept, but also what you are proposing as a work plan of activities until the end of next year. So I'm going to start my presentation with the definition of public health given by WHO on their website, which refers to all organized measures, public or private, to prevent diseases, promote health, and prolong life among the population as a whole. What the WHO also provides is the list of the three main functions that public health is meant to fulfill, which is basically assessment and monitoring of basically what's happening and what are the population at risk, ensure access to appropriate and effective care, and also the formulation of public policies. And the first question we can ask ourselves is, where is geography among all of these three functions? Well, I will personally argue that it's present among the three, and I'm just going to show you a few slides to illustrate that. First of all, when it comes to risk assessment, I mean, the highest risk is observed in areas, geographic areas, which are first of all exposed to hazards, but there are also those which are generally the most vulnerable and those that are having access to the lowest level of capacity. And this is independently from any type of hazard which can be considered biological, technological, etc., or independently also of the elements considered being at risk, population, infrastructure, or services in the case of health. So there is definitely a geographic dimension to risk, and in some way that's what is at some of the origin of modern epidemiology, and maybe one of the maps which has been the most presented in the world since the 19th century, which is of course the map by John Snow in 1854, who allowed him to identify the wheel which was at the origin of cholera outbreak in London. Now, when it comes to accessibility to healthcare, I mean, if you really want to analyze that, it requires to look at several elements which are illustrated here, which goes from both the condition of the patient as well as the intervention that is needed, the number and the distribution of these patients, as well as the location, of course, of the care providers and the resources they have at disposal, and in between the transportation media and the obstacles they can find on their way to search for care. These are dimension factors, indicators, which are not necessarily easy to combine together, at least not in a table or in a document. Luckily, all of them have either a geographic dimension or they can be attached to an object which is set as a geography. And using this allows to combine all of these elements together to look really at the question of accessibility to healthcare in terms of distances or in terms of travel time. So there is again a strong geographic dimension to this particular function, but I think at the same time it shows that geography can really be used as a neutral integrating platform, which is one of the interesting things here. And this capacity is what really allows more comprehensive and systemic, so looking at systems approach to universal health coverage, which, as you know, is a key element in the context of the Sustainable Development Goals, for example. Looking at the last one of this function, which is policy formulation, well, I guess all of you have already experienced the power, I mean, the visualization power of a map and the capacity to combine different information to analyze and visualize and analyze the spatial distribution of public health related issues. And this independently from the levels, I mean, going from the global down to the local level. So this really, maps are very often used to support decision making and therefore indirectly policy formulation. So I hope these three slides have been enough to demonstrate that the geography is indeed present across the three functions of public health. Now, this being said, the next interesting question is, I mean, how well is this captured in an health information system? And so the question more precisely is, can you think about one piece of data or information within this HIS that has neither a spatial nor a time dimension? And that's a question I've been asking for, I think, 5 years, at least 5 to 7 years, and nobody has answered yet. Find one element, one piece of data or information. I mean, if you find one, please put it in the discussion box, the Q&A for today. I will personally say that nobody has ever found one for the moment, for the simple reason that everything happens somewhere at a given time. And because of this, it should be important to capture both the geographic and time dimension of anything happening in relation to health, and these to contextualize every event in relation to these dimensions. But what seems to be obvious, unfortunately, is not necessarily what's happening in the reality, because these two dimensions are unfortunately among the most poorly captured in the health information system I have seen in many countries, more than 30, I would say, over the past 17 years. My personal first reason for that is that very often we take geography and time for granted. We think we have mapped everything and we know what time it is, but what we forget is that this is all evolving, and that constantly needs to be updated in order to have the most relevant picture of the situation for decision making. The other reason, according to me, is to be found in the whole question of and concept of data management. I mean, despite data being really at the base of the whole decision mechanism and decision process, very often it's not really attractive. I mean, it's considered. I mean, if you look at this is kind of an expansion of the whole data management chain. This requires many steps which are not necessarily attractive and on which is not necessarily easy to attach logo or whatever. And I think that unfortunately this has led to some of the issues we are facing today when we are kind of trying to really benefit from what geography and GIS has to offer in public health. Two things which is important, of course, what is presenting here, which looks very circular, is actually a cycle where, of course, everything gets improved and the needs being defined as things are improving and the situation change in the health system. The other thing which is interesting in the whole chain coming from defining the needs of the decision making is that GIS as a tool to generate information is supposed to come after having managed all these data issues, which is not always the case. I mean, in many countries, people have the impression that the first step is to decide on which technology they should be using, but there is really something happening before that. So just to give some definitions without going too much into details, but one thing which is critical, as you have seen in the chain, is the first thing is to ensure that everybody speaks the same language, which is not always the case. So talking about data management, data compatibility, and data manager, I think the critical element here is the recognition that this is really a valuable resource, which is at the beginning of the whole decision-making process, that very often we forget that not only information systems are supposed to be interoperable and therefore allow for data to flow, but the data itself also has to be compatible among sources and present enough of a quality to really be generating data products for decision making. And then at the end of the day, of course, you need people. I mean, this is not something which is done automatically. You need people, and these people are the data manager. The other thing which is critical, and I often see, is there is an impression that data management is the responsibility of the IT people, but it's not the case. Data management is really not IT, and this is not the work of IT to take care of the content. And this is one, again, going back to one of the issues which is often observed in countries, is the lack of this data management capacity compared to the IT capacity. Now, if we look at this from the more geo side, I mean, you all have an idea of what is a map. But I think what's important is to remember that the science behind this is what we call physical geography. There are different types of geography, political geography as well. And I mean, going up in geographic information, what we call also geospatial data, or you can use other terms, is actually information about objects that you can represent on a map. So as soon as you can represent that on a map, that you have all the necessary elements for this, we talk about geographic information. The system itself is an integrated collection, not only of software, but also of the information and I would say the people. And something which is, I think, key here, and there are different ways to represent a geographic information system, a GIS. The first element, which is often forgotten, is that the information itself is at the center. The software and the system it offers gravitate around the content and is there to both allow to add some more content into the database and then do something with it. I mean, generate maps, conduct some analysis, create reports. And then once again, of course, there is a need of some equipment, but just to emphasize, I mean, this is something which requires people to know, be knowledgeable about not only this whole schema you have here, but also the process I was showing to you before. So once again, the geographic information is at the center of the system. Now, if we look at what you can do with the GIS, I mean, this can be grouped in three main categories. Thematic mapping is all these colorful maps you have seen, which try to contextualize a particular situation. Spatial analysis will be more trying to look at the spatial relationship between objects and their potential connections. Modeling will be trying to reproduce some of the behavior which have a geographic dimension. So if we look at these two a little bit more in particular, this means first to look at contextualizing or looking at the relationship between a particular person, for example, and its environment, here the altitude, or also the built areas, the road, the river network, and then, of course, from a health perspective, the location of the health facilities or the source of water. Then what the GIS mainly, and this is really simplified, I mean, you can do much more than this, but principally looking at this relationship from the distance or from a travel time perspective. What's important to understand here is, of course, they are indicated on the screen in the increasing order of complexity. And together with this, you need an increasing level of quality. This being said, of course, this is all relative to the scale at which you are working, but the more you are trying to go close to a problem, you want to increase also the quality. Interestingly, this is actually inversely proportional still today of the number of users, meaning that the largest part of users of GIS in the world are using it for thematic mapping, but less for spatial analysis or modeling. And this is something we see also a lot in countries. Now, the last area, which is not there, of course, in order to be able to use the system, you need to create and manage geospatial data. And I will locate this, I mean, more or less at this level in these different triangles, of course, trying to aim at the highest level of quality, complexity being not as much as modeling, and the number of users being in the middle, because we need that for all of them. Now, if you really want to benefit from geography and more precisely GIS, I mean, in the GIS, you need to adopt what we call an object-oriented approach. And these objects, I mean, you have examples here, will go from a patient up to a country going to a village. These objects have all a set of attributes being attached to them. These attributes can be statistics or information. Now, using these objects is what allows you to generate maps. But actually not only maps, because behind any table or any graph, you have a particular object. I mean, you do represent, for example, here a power supply according to administrative divisions, or a number of health workers per cities, let's say. These objects call for to look at a little bit at particular concept, which is the one of registries, which is kind of core to AeHIN in general, and the whole health information exchange in particular. So this is a kind of a personal definition of a registry, which I hope you will agree with me. Which I see that as the authoritative, standardized, complete, up-to-date, and uniquely coded list of all active records for a given object. So it means if you look at health facilities, administrative divisions, or patients that correspond to this list of these particular entities or objects, which are supposed to be updated and maintained. Now, one way which is to look at how key this is, and this is a personal representation of this HIE schema that some of you might have seen in the context of AeHIN activities, where you have the interoperability layer at the bottom and the database at the top. Actually, none of these data should normally reach the interoperability layer if they are not compliant first to the different registries, the ones you have here, that they are documented in such a way through a metadata so that you know clearly if the use is appropriate, following an agreed upon terminology. It's only if they comply to this that they should be reaching the interoperability layer, and this independently from the application or the software you are plugging in. I have just highlighted here outline in red the administrative divisions and the village, because these are two critical registries which are not necessarily emphasized in the context of the HIE, which actually are key in order to look at the geographic dimension of public health. Now, of course, the registries is not the only element that you need to look at, but there are several other important reasons why it is critical to develop and maintain these registries. First of all, it's because that's what really facilitates data compatibility as a complement to system interoperability, like I was mentioning before. This is also the way to avoid duplicates, because once everybody is really using the same registry as a reference, it makes sure that everybody talk about the same object, about the same health facility, the same administrative division. It minimizes duplicates, it improves record keeping and reporting, it provides also the denominator for data collection and monitoring and evaluation. It's critical to know if in a particular province you have 10, 50, or 100 health facilities, especially when you have big disasters like we experience here often in the Philippines. That's what also support better analysis and synthesis of data. And finally, in the context of today, that's also serve as the entry point for the GIS if the geographic dimension of this object has been captured. So the registries are really supporting decision making as well as health system functioning, and they should be a key pillar of any information system. Unfortunately, as you know, often they are non-existing, or when they exist, they are incomplete or out of date. So this all brings me to the concept of geo-enabling. Of course, the registry is not the only element which is needed to be able to look at benefiting from geography and GIS in health in countries. So what we mean by geo-enabled health information is an health information that can fully benefit from the power of geography and GIS. So what does that mean? Well, it means that a set of things have to be in place. First of all, a clear vision and needs. Governance structure has to be also established, and minimal technical capacity has to be available. There has to be specification standards that have been defined and implemented. Then the registries, which I was mentioning before, but it's not only that they should be there, they should be maintained, updated regularly. And then, of course, there has to be protocol to ensure the availability, quality, and compatibility of all this information, and this across the whole data life cycle. In addition to that, we need to make sure that the appropriate GIS technology has been identified and used, that there is policies in place, and that support and enforce all the above, as well as accessibility. All of this so that at the end of the day, geography and GIS are there to support decision making. So this is not necessarily something which is straightforward for the health sector in countries to implement, and this partly by lack of data management culture of capacity. And we have seen over the past decades that doing trainings which cover geospatial data management practices is not, sorry, let me start again. The usual GIS training do not necessarily cover the issues of geospatial data management practices. And that one-off training is not enough to really understand all the concepts, being able to go through the whole process to really have a sustainable GIS capacity in countries. So there was a need to come up with a different approach, a new approach. And this is where the AeHIN GIS lab comes into the picture. And what's happening is that thanks to the support of ADB and WHO and taking advantage of the existence of AeHIN, what the GIS is trying to do is to enable countries to receive support, to go through this process of geo-enabling their information system, to learn how to embed this GIS technology into good data management practices, to access knowledge, skills, and expertise, to find solution also to the problem they might be facing. At the same time, there is a need to look at developing a curriculum specifically for health geography and GIS, and also test tools which are constantly being developed, and ensure that they are interoperable with others and that they are also promoting data compatibility. There's also the willingness to make sure that countries can benefit from public-private partnership, aiming, for example, as facilitating access to GIS technology. And last but not least, learn from other country experience and best practice. And so all of these goes very much in line with this teaming, teaching, testing, and tooling you have heard a lot, and which I really like coming from Derek, and which is used in more lab, and which perfectly applies here as well. So what we are looking at now, based on all of this, is an approach for capacity building and strengthening in the region, which will look at prioritizing one-on-one in-country training so that it's more adjusted to specific needs and capacity, and also to ensure that we have the right people that attend the training, to look at pilot projects instead of one-off training events, to provide more long-term coaching, so to really guide people through the whole process of data management and using GIS, but still using regional gathering, but mainly to look at the basic concept and processes, and not necessarily at training on software. And also, more importantly, to use that as a place for countries and other partners to share their knowledge and experience, as well as identify common needs and challenges. In that regard as well, the lab doesn't intend to organize software-specific training, but to really do that with the professional when it is needed. And also developing this health geography, medical geography /GIS curriculum for public health schools. This is kind of the more long-term objective to ensure that sometime in the future, our new Minister of Health or undersecretaries, etc., have really a different way to look at health geography. So we're really looking at long-term capacity building and strengthening. So the expected outcome, starting from the lab, using this 4Ts approach and the activities which are leading to it, the whole idea is this long-term capacity building strengthening, so that there is a proper geo-enabling of the health information system, which itself leads to improved geographically based decision-making, and therefore a more systemic approach, and this is important, the whole system concept, approach to solving public health problems. So this is really what we hope, and this is what we call the GIS lab wave of change, and what we hope to see in the future. There are two main drivers, two high-level political drivers that we're using for that right now. One is universal health coverage, as I was mentioning before. The other one is malaria elimination, because that's an important concern, and there's a big overlap with the AeHIN member countries. Now, so what resources do we have at disposal to help trying to do the change? Well, first of all, there is some staff, and I'm lucky to have Ise working with me right now in the lab. What we are trying to do also is to really develop the network. When we start looking at this, we actually realized we didn't know who is really working in the use of GIS in public health in Asia and the Pacific, and we therefore don't know also who are the critical nodes of this network. So we are using some online tools to develop this network, and I'll mention about this a little bit later. At the same time, we are working on providing, thanks to ADB and WHO support, on providing on-site support to 6 priority countries, those that are highlighted in orange on the map here. And these to assess gaps and needs, advise on how they can align their plan to geo-enable their information system, or to implement these strengthen capacity, but also help coaching some GIS-based projects like ADB malaria and dengue risk mapping project. Then the other countries which are in blue which are the other 17 malaria endemic countries in the region, are there to receive remote support. And these concern technical assistance to the use of ArcGIS Online, AGOL is ArcGIS Online, and other license that you can access from Esri, as well as potentially other domains. But of course, this is all depending on the resource we have at disposal for the moment, which hopefully will grow as time is passing. Talking about Esri, I mean, this is one of a very good public-private partnership that we have the chance to have established between AeHIN and Esri, which give access to several different resources to countries. First of all, licenses which can be borrowed for a maximum period of 6 months or 1 year, which are accessible to institutions health institutions in 39 countries. So we are already beyond the 6 plus 17 I was mentioning before. You find there is a request form that you can download from the AeHIN GIS Lab website for this. At the same time, thanks to Jack Dangerman, who is the president of Esri and his staff, we have been able to set up a highly discounted set of bundles for Esri GIS softwares, which are accessible to the Ministry of Health in 35 countries. And you're going to have soon a brochure describing these bundles more in details from the website as well. So these are two of the capacities and a very good example of I guess, the brokering role that the lab can play for people to access this technology. At the same time, I mean, we are working on reference material. I mean, this is something we have been realizing across the board. There is a lack of guidance on how to best go about the whole process for a sustainable, effective use of geospatial information in public health. So, I mean, there is already a brief that you can find also from the website or from AeHIN GIS website, but we are currently working on a series of documents which goes through the whole process I was showing before.
Hello, Dr. Steve. I think there are technical problems on your side.
Activities between now and the end of 2017. First of all, from a governance advocacy perspective, we're looking at establishing the AeHIN GIS Lab board. The reason for that is because we want the lab to really be the reflection of the needs and challenges in countries. We are not here to develop something which will be pushed down to countries. We want really the lab to adjust itself to what's happening there. On terms of capacity building, apart from the on-site support in 6 countries, we hope to have also a national level GIS lab being established at least in 2 countries. Developing these guidelines I was mentioning before, also to help using GIS to conduct analysis in relation to universal coverage and develop this curriculum I was also mentioning before. In addition to that, we're really looking now at extending the network of expertise and develop a knowledge repository. So for the lab to really become a knowledge hub for not only the governmental sector, but also for the academic sector or the private sector, so that all these key partners can exchange key information, be knowledgeable, but also knowing about what's happening and what are the needs. We look also at developing a prototype of GIS-based health facility registry, and that's something that's going to be documented. And we're going to maintain these and animate these online resources we have with our GIS Online and social media platform like GeoNet and LinkedIn. In terms of events, those that are planned for the moment, I mean, most of you are aware, I guess, about the 5th AeHIN general meeting to take place at the end of November in Myanmar. And this is where we hope to have a pre-conference knowledge experience sharing workshop among those interested, and where we're going to be able to showcase also Myanmar's experience working with the lab. We have started a project with the Department of Public Health, which will lead us to something we'll hopefully be showing with you by the time of the meeting. We hope to also have the first meeting of the board. First of all, we need to establish the board, but hopefully that will go together. We're also very much looking forward to the possibility to present what is being done during the Esri user conference, because we think it's a model that could benefit also other thematic areas and other parts of the world. And there will certainly be other capacity building or advocacy events that we still need to identify. So just to give a picture of the middle-term vision, and I know some of you have seen that in Bali last year, and the vision has not changed. The whole idea is to place the GIS lab as an addition to this community of interoperability labs, the COIL, as a regional resource to serve not only countries who will have their own GIS lab, but also any other countries which are at different level of maybe of development and starting to appreciate and wanting to benefit from what geography and GIS have to offer. So in conclusion, I hope I've been able to demonstrate that there is a strong geographic dimension to public health, that geography and time, while very important, are often poorly integrated in the HIS, that ministries of health that would like to really benefit from geography need to have in order to have a more systemic approach to public health, should therefore invest in integrating this dimension in order to geo-enable their HIS, and that this is not necessarily a straightforward process. And therefore, the lab has been established to help these different stakeholders to meet and share the necessary knowledge and expertise in order to strengthen and build capacity through innovative approaches in the region. So what we really would like is to invite all of you to, first of all, join us either on LinkedIn if you are more kind of looking at general knowledge sharing on GeoNet if you are more on the techie side, or contact us if you have any questions, suggestions in regards to what we are presenting or specific needs or challenges. And you can also visit the web page about the lab on the AeHIN website at the following link. And I just have to just thank you for your attention and remain, of course, at disposal for answering questions and hoping there will be an interesting discussion. Once again, I mean, we're here to really help to make sure that in addition to the focus which is given to technology, there is also the right importance which is given to data management. Thank you once again.
Yes, thank you for the presentation, Dr. Steve. May we now have the questions from our participants. We have a question here from Engineer Derek. Engineer Derek, would you like to speak on your microphone? Hello?
Can you hear me okay?
Yes, we can hear you now. Thank you.
Steve, thanks for a wonderful presentation. One of the things I'd like to ask is specifically about the registries that you've correctly noted are not often found within an HIE data model. And the registries around administrative divisions and the village registry are of particular interest. Mm-hmm. Who is the source often for these data, and what is the governance around these data? And in your experience, if these data are weak or incomplete, how can we address these weaknesses?
Thanks, Eric. This is a very good question, and one of the reasons why also often there is a need for the health sector to connect with other governmental agencies. I mean, in a perfect case, there will be a national data infrastructure with a spatial component, which is something which is often missing. Now, to answer your question, it actually depends from one country to another, but in general rules, the institutions which are concerned are the National Mapping Agency, the Statistical Agency, and the Ministry of Interior. These are generally the three key entities there. Exactly like for health facility registry, very often the administrative division and the village registry also is incomplete or sometimes non-existing, incomplete, not up to date. I think this is where the health sector, by providing particular concern, I mean issues that needs to be addressed, which are very high on the agenda, the political agenda, can help to also emphasize the importance of also looking at these registries at the same time than those which are managed by the health sector. And also for the health sector to be more connected to these more kind of cross-governmental processes.
Are you thinking that the health sector would become a source of these data, or a curator, or both?
No. I think they are more on the user side, and that's where they should be. I think really the mandate on these two layers is under this agency. But this being said, I mean, especially if you look at villages, I mean, you can have a huge number of villages in certain countries. Maintaining the registry as well as maintaining the location of these villages is a big exercise, like what is happening for health facilities. So a more coordinated approach that will include the health sector, where you have people going to these villages, could maybe help these institutions to keep these registries more up to date. For the administrative divisions, that's a different story, because the question of where do you place the border between two municipalities is really outside of the scope of the health sector. But
sure, it can often affect concepts such as catchment area for a particular care facility, and catchment areas and population served within a catchment area, and the referral networks or the natural referral networks when care is being escalated. Those ideas would sometimes, but not always, map on top of the administrative divisions.
Yeah. Yes.
But I'm just curious, and I apologize for not knowing this already, but what's the format for these data? These are shape files, right? Is there a standard format for how those are represented, or does it depend on the software that we're using?
Well, I would say that the format, luckily, is not an issue so much anymore nowadays. I mean, it used to be the case like 10 years ago, 10 years ago maybe. I mean, even if there are some formats which are not something which is necessarily endorsed, but by the number of users, and also, I would say, by the ease of use, which are kind of coming in, and indeed shapefiles, for example, for what we call vector layers, for point lines and polygons, is something which is largely used. But you have other formats as well. And I would say that really the issue is not at that level. It's more at the level of defining the needs, defining the data specifications, and making sure that the data is collected according to standards and protocols that have been defined. Once this is done, the format is less of an issue, I would say.
Steve, thank you very much.
Thanks, Derek.
Right. We have two questions from Dr. Estella. The first one is, how can people get access to the resources that have been created? And second, is there a way for countries to participate in the development needs related to curriculum development?
Sure. To answer the first question, that's the last slide. You can just contact us for this when it's a generic question. If it's in relation to the particular software resources, you have forms there on the website as well, and soon the brochure that's going to be indicating how you can access to the bundle thanks to Esri support. In terms of the curriculum, I mean, this is definitely something we just started discussing. I was in Jakarta earlier this week, and I had the chance to meet with Pak Gugu from Gajah Mada University, and he's definitely interested in contributing to developing this. We'll certainly open that to a larger number of institutions as possible, so that we come up with something that could go across all the different contexts we can face. What ESE is also working on right now is to, and that's where certainly some of you could help us, is to identify what are these public health schools, the key ones in the region, so that we could also go and have a look at their current curriculum and where, see if and where geography and GIS is being included. I hope I answered the question.
Thank you, Dr. Steve. Dr. Alvin is raising his hand. Hello, Dr. Alvin.
Thank you, Cherise. Thank you, Steve, for the very interesting presentation. I have two questions, and I'll ask them one after the other. While you were giving your presentation, I was doing a poll on which countries already had some degree of GIS systems, and I got responses from Malaysia, India, Sri Lanka, and I was gonna ask a question: what can we do as an AeHIN GIS lab in terms of connecting these capacities together? That's for the first question. The second question is, do we need to provide any guidance as to some generic data constructs or standards to be able to interconnect them, or we can just let them do their own stuff, but at some point be able to consolidate data from different countries into a regional map? Over.
Okay. So thanks, Alvin. On the first question, I think this is where the whole idea of the board and also of having this pre-conference workshop during the next GM comes in. I mean, we need to basically build a network. As I was saying before, I mean, we don't know right now who is actually working, who is doing. And I mean, I'm looking some of the questions. I see there is also some mixing in terms of concepts. I mean, when I was defining GIS before, I mean, I was looking at the different capacity that it needs to cover to be called a GIS. What you have in DHIS2, for example, is not a GIS. This is a thematic mapping application with a limited number of functionalities. This is not GIS. I mean, this is a personal view on that, without opening a debate there, but I think there is a need to really help to also clarify the concept and the terminology. Now, on the second question, and this is one of the issues we were discussing earlier. Also, I was in Esri, Philippines today, and Linda from Esri was asking, well, can this link to developing an atlas? I mean, for the region, and I would say, why not? I mean, on the long term, if we manage to have a certain set of, but again, it's not going to be technology standards at this point. I mean, the main issue for developing a regional atlas is more on the question of the international boundaries, for example, to make sure that there is consistency across the borders. The issues will be a lot on the question of defining the indicators, right? More on the attribute side. And of course, the geography will have to match these indicators. I would say that this is definitely something to keep, and there are, I mean, of course, maps being drawn. I mean, for example, Chris, who is online, I think, from Moru, has been developing subnational map showing the distribution of the prevalence of some diseases. So this is possible. Now, in an ideal scenario, what I think is what you're looking at, right, is thanks to having made the whole region interoperable and having really systems that talk to each other from one country to another, and these geographical issues to be solved, you could automatically just pump into the separated information system and get your regional picture, right? I guess that's what you're looking at. Am I correct?
Yes, exactly. Especially Steve, that there's going to be moves towards sustainable development goals, and then in the SDGs there will be a dimension on subnational data. I was hoping that the AeHIN GIS lab could help countries be responsive to their local needs, looking inward, but also compatible with the regional reporting framework that will come from agencies like WHO. Over.
Well, I will definitely welcome the possibility for the lab to be the forum to discuss what could be done in order to reach this regional, I would say, data compatibility in this case, right? Now, it's going to be interesting to see if really the SDGs are going to go subnational like they're asking for, because that was one of the conclusions of the MDGs, is that unfortunately by aggregating the data too much, you're masking pockets of heterogeneity at the subnational level. But I guess, again, this will require more than technical issues to be solved. And we'll go into more political issues in relation to boundaries. It's certainly possible. I guess it's going to take time. Well, we have 15 years in front of us. Let's see.
Let's use the network as a discussion point for that. I have one last question. This used to be theoretical, but now it's becoming real. If we get an audience with the Secretary of Health of the Philippines, what can we very quickly tell her? This is what the AeHIN GIS lab can contribute to the Department of Health. Over.
Well, I guess we can definitely help them to go to the next stage. As you know, we were involved, you and me, in working on improving their national health facility registry. And I know that since then there is an embryo of data management unit which has been created. The latest news I got is that the person in charge of GIS is not sitting in that unit, it's separated, and that this unit is being asked to basically do different things which will require to have some benchmark or some things in place which are not yet in place. So I think there is a lot of space to help them, now that they have a registry, to first enforce the sharing of this registry internally and externally. I think there's a lot of things to be done from the accessibility perspective in the Philippines. At the same time, to help them to go to the next stage and to do something with the data. So to go to the analytical side and potentially the modeling side. And to really enforce the introduction of these registries in the different systems, because at the latest time I knew, the latest news, this was still ongoing and not done yet.
Great. So what I can probably tell them, Steve, is that they can probably join the efforts of face-to-face efforts of the AeHIN GS lab in Indonesia, because they also wanted to benchmark also with other countries.
Sure.
Thank you, Steve.
Thank you, Alvin.
All right, thank you, Dr. Alvin and Dr. Steve. We have a question here from Dr. Pamod. He's asking, how can we connect to the AeHIN GIS network?
Okay, so you have basically the link on the last page right now. So I think, as I was mentioning, LinkedIn is more the platform we are using to kind of more sharing knowledge. So about events, about publications, I'm starting to initiate some discussions there also. So the first one I put there was on the strategy for capacity building strengthening in the region. I'm going to put one on terms of the benchmark. The GeoNet is more used to more for technical questions, like really software-oriented questions. So that's the first thing. The second thing is all those that are going to have the possibility to attend the general meeting in November are of course more than welcome to have someone sitting with us during the pre-conference workshop we will have, because this will be for me the starting point to look at developing the GIS lab board. So to have something similar like the working council, but made of people working involved or really highly interested in the use of geography and GIS in countries. And I think that's the next two steps. From there, we will see if there are other opportunity we could use to expand the network.
All right, thank you, Dr. Steve. Earlier, Dr. Fazila was asking if she could speak on the microphone. Dr. Fazila, would you like to speak on your microphone? Hello?
Yes, go ahead, Dr. Fazila.
Hello? All right. If there are no more questions from our attendees, maybe we can wrap up this session. We will be uploading the recording of this webinar. If you have questions, kindly feel free to email us. Thank you for attending this webinar, everyone. Thank you, Dr. Steve.
Thank you to everybody, and look forward to interactions. Please don't hesitate to contact us.
Thank you, Steve. Thank you.
Thank you, Steve. See you at LinkedIn.
Thanks.
Good night.
Bye-bye.
Bye. Good night, guys.
Hello, Chris? Hello? Hello?
Yes, Dr.
Hello,
Basay?
Chris?
Hi.
Yeah, should we enter
Jenny,
again?
Are we transferring rooms or are we staying here?
I will transfer. We'll transfer po.
Transfer.
Yes
Okay.
po. Thank you.
What's the room number? What's the room number?
I will remind everyone, Dr. Alvin.
Just yeah, just send it through Viber.
Yes.
Viber. Thank you. See you
Thank
there,
you.
guys.
Thank you.
Bye.
Bye.